Good evening, everyone.
Hello.
Welcome to our webinar tonight. We've got a lot of people connected. I can see already we've on about 85 people already. I'm sure there's a lot of other people that's still going to connect. We probably have a few latecomers. Welcome, Giulio, all the way from Italy.
Thank you. It's a pleasure being here.
It's really nice to have you here tonight. I can't wait to learn from you tonight. I wanna quickly introduce you guys to Giulio. So I've gotten to know him a little bit. We've had a few chats about composites and about anterior restorations, and he's a really nice guy in terms of sharing. He really doesn't care to share his knowledge. I've also heard of his lectures, and I know that he's part of the Style Italiano group, and his reputation really. So I had a sneaky preview on what he had in store for us tonight, and I'm really excited to actually for you guys to also see that. I was asked to introduce him, and I different tonight. Let's not do the normal dentist thing and just look at his CV. And his CV is impressive, I can tell you that much. But I'm going to quickly show you his actual Facebook page. It's quite something to see. So I don't know about you guys, but whenever I look at a dentist's Facebook page, all you see is teeth, but not this guy. So apparently he really likes food and wine, and being from Italy, that's what you sort of expect. And it sounds like, Giulio, you can correct me here, but are you a sommelier as well?
Yes.
Okay, so you really know your stuff when it comes to food and wine.
Yeah, you can see looking at my size. I'm very passionate in food and wine. I'm Italian, and what you said about having picture of teeth, of course I have picture of teeth on my Facebook page, but
yes.
I always say that I'm a dentist to live. I don't live to be a dentist. So my life it's other than teeth, but of course I have a deep passion for my work, but it's just a job. Life it's other stuff.
Of course. And so if I look at your profile on the Style Italiano page, there we can actually see that you are really passionate about dentistry. You graduated magna cum laude. And you're also now an associate professor at the University of Siena. You've also been a co-author of some really interesting books. And then obviously right here at the end, you say that you enjoy dentistry, but you also enjoy life.
Yeah.
And this is what I find when I look for the town that you're from. So I can tell you that I'm very jealous if I look at that. So guys, just to give a little bit of an extra introduction, Giulio is going to teach us about anterior composites, but he's an amazing human being. So I'm really, really excited to learn from him tonight, and I'm sure that we're all gonna walk away from tonight in a richer, just with having contact with him tonight. So Giulio, I'm gonna hand it over to you now.
Thank you. And it's not just to say, I really mean it. It's been the best presentation I ever had. Really. I really appreciate it. And if all of you participants, if you ever come to Tuscany in the center of Italy, just consider me as the perfect touristic guide for food, wine, and for everything. Dentistry is my second job. Okay. Do you see my screen, Corna?
Yes, I see your screen, but
Is it in full
I
screen now?
see that's perfect.
Great.
That's perfect. Yes.
So just to tell all of you have on the right side of your screen the chat window. Feel free to write some questions or comments or whatever you want. And after the lecture, we will have the Q&A session. But Dr. Smith will be able to interrupt me every time she wants to make it interactive. We only have 40 minutes, about 40 minutes for the lecture. So I'm not saying that I want to teach you something. I just want to share with you all my daily job, my work. You will not see Congress cases, amazing cases, or wow cases. I work in the real life in a small town, as you saw in the picture. So I can't take half a morning to make a central incisor. It's not affordable for me. I live in the real life. So you will see what I do every day, and I will show you some mistakes, because I think the most important thing is to try to avoid mistakes in the daily life. So I always want to thank the Study Italiano group, because it's a real help for me in my everyday practice. Okay, let's go inside the topic, anterior direct restoration. And you see an old trick, an old image here. It's quite old, but it's very useful for us, because you see a dark gray on the top and a light gray on the bottom. But if you put your finger in the middle and you do something like that, you realize that the gray was the same. It's just an illusion. And this is a stupid example, but it's very in the topic, because everything we do in the teeth of our patient should be an illusion. It's impossible to have the perfect restoration. We just need to make the artificial look like natural. So everything is illusion. And of course, every time that I speak about aesthetic, we always start talking about color. Actually, color is the less important stuff, but we need to talk a little bit about color. And as you perfectly know, in dentistry, we have the less accurate, the less scientific way of naming colors. We have hue, chroma, and value. Hue is quite useless. In dentistry, we have red hue and yellow hue, maybe, just as basics. But I bet no one of us can 100% say this kind of tooth is a red hue. I'm sure 100%, because the hue is really irrelevant. Of course, the chroma is more important. Chroma or saturation is very important, but in the field of color, that is not so important. The only relevant parameter is value. Value is the quantity of gray, or if you look on the other side, is the brightness of a color. So it's quite easy to understand that these three rectangles on the left, they have different value. The one on the left has lower value. The one on the right is the more bright. It's easy, but it's not so easy to understand the value of the rectangular on the right, because you have different hues and different chromas. Why it's so important to understand value? Because if you make a mistake on value, the patient will notice the mistake. If you make a mistake of 2 tones of chroma, maybe a colleague, maybe a dentist will be able to notice it. But if you make a mistake on value, maybe the patient comes back to home and the wife says, okay, you have a gray tooth, because it's really easy to see. So what we can do, we can remove the color, we can desaturate the image, and put in the image on grayscale, we can appreciate the value. This is something important because it's so easy to do it in the mouth of our patients. We can take the picture of the teeth of our patient using a shade guide, possibly not the Vita shade guide, but a shade guide made with the composite you're planning to use. And then directly from the back of the camera, you can turn the image into grayscale. And so you can appreciate the value, that it's the most important parameter in the color field. Okay, I already said color is not the key. Very important is the diaphanity concept. So an object can be opaque, transparent or translucent. And we have a lot of different degrees of translucency in teeth. And it's very important to focus in this topic, especially if we talk about Tokuyama composite. So here you can see a common case where you can find a lot of translucency in the incisal third of this central incisor. And you see it bluish, you also see it very dark because the enamel is translucent, so you can appreciate the darkness that is inside the mouth. Then, if you have a lot of dentine, of course you will have an opaque mass. So no light is passing and everything is opaque. And then maybe you can have some characterization. So the white spot, it's funny because when we have a white spot, we try to remove it with microinfiltration. Sometimes we don't have white spots and we put them with stains. So we as dentists we are a little bit strange. And also we can have the incisal halo. So here in the incisal edge, we have the prism of the enamel that are changing their direction from buccal to palatal side, and they're able to stop the light. So if we want to reproduce this incisal halo, we need to use an opaque material. And how can we manage the opacity of materials? Two ways. If we have the same material, we can increase the thickness. So with the same composite, we can have a transparent layer, or if we increase the thickness, we can have almost a very opaque layer. Or we can change the material. If we wanted to maintain the same thickness, we can use a translucent material, an enamel composite to have translucency, or a dentin composite to have opacity. And this is really the key to understand the use of Tokuyama material. We are really running because we have short time, but I really need to talk a little bit about anatomy, because as I said, color is not so important. Translucency versus opacity, it's really important. But what's really, really, really deeply important is anatomy. Because a mistake in anatomy, in shape, it's really visible. It's really easy to understand, even from a normal patient, from people, generic people. And I always suggest people to try to find this old book, Fundamentals of Aesthetic. It's a book from Claude Ruffenacht, a Swiss dentist, and it's from the late 80s. So it's quite old. It's not easy to find it. But if you can, believe me, if you read it, it will be a great lecture, because this book will guide you through the vision. So you will understand how to look to a patient, how to notice important details, and how to exploit these small details to reach your result. And so, thanks to Ruffenacht, I understood that I had to look a lot of different details, such the line, the smile line of the incisal edge and of the apical edge. It should be symmetrical with the lower lip line, so we have a positive smile. And we always need to appreciate, and if needed, modify the inclination of the axis. It's very important, and it's strictly related to the position of the zenith of the gum. And this is very important in aesthetic, because it gives you symmetry. Or maybe if you make a mistake, it can give you something that is really disturbing the view. Then we need to pay attention to embrasures. So the little triangles on the incisal edges, these are really important. Sometimes you just need to take a little disc and make a smooth angle on the lateral incisor, for example, to modify completely the outcome of the smile you're creating. And of course, you need to pay attention to proportion. The idea of the golden proportion, it's not so real, of course, but we need to have the idea of a central incisor that is bigger than the lateral, of course, and the appearance of the canine from the frontal point of view. So we need to focus in this proportion, and we also need to have in mind the relationship between the height and the width of teeth, because it's very important. And that's what I said 1 minute ago. The lateral incisor, for example, it's very important. You can have it very feminine, like this on the left, very rounded and smooth and very gentle, or you can have it quite squared. This is very masculine. It's quite aggressive. So if you have a young lady as a patient and you make a lateral incisor very squared with the distal incisal angle very pronounced, it's not the tooth for that mouth. But with just a little movement of a disc, you can change the outcome of the smile. And that's, once again, the topic of proportions. It's very important because we always need to keep in our mind that everything is an illusion. So as you see on the left, you have 3 teeth. They have all the same width. But of course, the one on the right seems to be fat because it's short. So the proportions are not good here. And we always need to keep in mind the target of proportions and harmony. You can use the nice tool. It's called the choose proportion gauge, or maybe you can just use a periodontal probe and measuring. It's fine. Just keep in your mind the proportion between height and width. And this is very important in all the cases where you need to close diastemas. I really love diastema closure cases, and I really love to make them directly because it's always a challenge. But of course, if you need to close diastemas, you need to enlarge the teeth. So increasing the width of these teeth, you should also increase the length if you want to keep the proportions. Sometimes you can. Sometimes you can increase the incisal edge. You add some composite. Other times you can go with surgery. So you make apical surgery, resective surgery, and so you increase the length in the upper, so apically. But sometimes you can't. So you need to pay attention to some details and play with the illusion. We need to pay attention to transition lines. Transition lines are these lines where the light reflects. When the teeth are covered by the saliva film, you have the reflection of the light. In this point, when you have the change from the buccal surface to the interproximal one. And these are very important. They need to be very regular, very smooth, and then you can use them to change the perception of the dimension of the teeth. Try to explain what I mean. Take this as the initial case. So you see, you have in this position the transition lines. And if you take a look from the incisal edge, you see that you have the transition lines on the top of these 2 convexities. And this is the way the light reflects. So you receive the reflected light and your brain create the image. Let's say that you have to close diastemas. So you have to increase the width of these teeth and you have the risk to lose the proportion, but you can't increase the height. So what can you do? You can move the transition lines toward the center, doing like this. So you reduce the surface in between the 2 lines. And if you take a look from the bottom, it's like this. From this situation, you create a more convex surface. This will give the illusion of having longer teeth. So you can make miracle, of course. It's not a miracle, but when you're quite borderline, you can save your result. Just moving the transition line toward the center. On the opposite situation, when you need to give the illusion of larger teeth, and I think, for example, when your patient has periodontal problems, so a lot of loss of periodontal attachment, so you have these very long teeth, very ugly, with the black triangles in between them, and patients usually ask us to fill a little bit this black triangle, and if you move the transition lines toward the borders, you will give the illusion of having larger teeth. So you will have a little bit more proportions in the smile of the patient. So from the bottom view, you will have from this situation to this very flat buccal surface. And it's quite an easy trick, but I always find it very useful in my daily practice. Then, of course, we also need to pay a lot of attention to the texture. Not every tooth is completely smooth. Actually, most of the teeth are very rough in the surface. And when the teeth are wet by the saliva film, the reflection of the light can be quite scattered by the roughness of the surface. So if you have a very rough surface and you make a class 4 restoration and then you polish perfectly using all the burrs, all the discs, all the pastes, whatever, you will have a beautiful restoration, very glossy, very smooth, but it will not look like natural. You will see that it's something fake. So a lot of times we need to replicate this roughness and try to make it look like natural. And my professional life in the field of finishing and polishing completely changed when a friend and a colleague, that is Jordi Manauta, showed me this kind of burr. And I need to tell you the story because it's quite a funny story. But Jordi was about to run a course, a hands-on course, but the organizer just forgot to bring the handpiece, the red ring handpiece. So he had no chance to use the normal flame burr that everyone uses to finish composite. So they said, okay, let's try to find some burr that fits in the blue triangle, but it looks like a flame burr. And they found out this kind of burr. And as you can see, is a blue ring burr. So it's quite aggressive. And Jordi, that is a brilliant guy, it's a genius, just made a trial just to see how this kind of burr could work. It's a burr designed for periodontal surgery, and it's very aggressive. But immediately, Jordi realized that it was perfect to finish composite because it's a very coarse burr, so you can use very slow RPM. So low speed, very low speed, very gentle touch, and you can be very selective on removing structure. So you can remove all the composite you need, and you will not scratch enamel, so sound enamel will be safe. And most of all, you will leave this perfectly natural texture on the surface of the teeth. And also thanks to the new materials that are really highly polishable, I need to say that 80 to 90% of my cases, my finishing procedure is just this burr and a silicone tip, like you see in the movie now. So summarizing this little introduction that we made, we need to keep in our mind that shape is the key. Shape, symmetry, harmony, this is the key. And to try to change a little bit in the shape that we have available, we can play with transition lines. They are very important. Then we need to pay attention to opacity and translucency. This is the key with Tokuyama products. Because if you make a restoration that is too translucent, it will end up to be gray. It will look like gray. You will have a decrease of value. And maybe you see the patient next week and you say, okay, we have a gray restoration. I need to correct. Last time I used A2. Maybe this time I need to use A1 to correct. No, most of the time, this is not the problem. Most of the time, you can put your finger on the back of the restoration. So you make an opacization of the tooth, of the restoration, and you see that the gray appearance disappears. So you understand that the problem is not the color, the problem is the translucency. So your correction will be not changing from A2 to A1. The correction should be removing some enamel and replace it with some dentin on her body to cover, to stop the light. Then, of course, we need to pay attention to primary finishing, then polishing, so the texture, and last step, color. Okay, of course, we need to choose a technique. And the technique we use it's strictly bonded to the material we use. Just a little bit of history. You perfectly know this kind of technique because it was the first one. And I really appreciate the work of Dr. Vanini. It was the first one to give us all a technique, a standardized technique to layer composite in anterior. So back in the early 90s, Dr. Vanini took the technique from the lab, the technique to layer ceramic from the lab, and brought it into the composite field. And the aim of this technique was to imitate the natural anatomy of a tooth. So palatal enamel, dentin, a layer to connect dentin to enamel, and then final enamel. And the technique was quite tricky, was really hard and really depending from the hand of the operator. It was not so easy to be confident, to be self-confident, and to say, okay, I see this case, I have good chances to make a nice result in the first shot. It was not so easy. And it was time consuming, and most of all, it was not easy to correct. Let's go deeply inside the classic technique. So you had to put translucent enamel, as you perfectly know, as first layer, then different layers of dentin, desaturating the chroma. So going from the most colored color and then cover it desaturating from A4 to A3 to A2, just to give three-dimensionality to the tooth. So we needed to use this technique not to have a fake restoration. Then we could put some stains, some effect, opalescent, white spots, blue, whatever. Then a thin layer of a flowable composite that was called glass connector. It was a fluorescent mass, and it was really important to dissipate the light and to give the illusion of a natural outcome. And then in the end, a final layer of enamel. As you perfectly know, it was not easy to do, but especially it was not easy to correct. Because on the second appointment, what happened every time to me, it was, okay, I see a mistake. But it's not so easy to understand which one of this layer was the wrong one. So it was not easy to make a selective correction. And every time my correction would just to remove all the restoration and start again, making just a new attempt. Now we have the chance to make evolutions of this technique. And if you use a Stellite Sigma Quick composite from Tokuyama, you can start from this technique, from the Vanini technique, but you can simplify it a lot. But to do so, you really need to understand a couple of things. First of all, the filler. The filler of this composite is spherical, and it's very high aesthetic. It's mimetic. It's not magic. It's just physics. What does it mean that a composite is mimetic? It means that the composite has a refraction index that is very similar to tooth structure. Just imagine the situation. You have the tooth, and you have the restoration that is bonded. The light from the environment just hit composite and tooth in the same way and goes inside the materials, and then spreads. If the refraction index is almost the same, there will be no major changes in the direction of the light. So when the light will be reflected toward your eyes, you will see no differences, and you will have the illusion that the composite and the tooth are the same. So the composite is hiding itself. So let's go deep inside the systematic of Tokuyama Stellite Sigma Quick. The most important mass is this first one, OPA2. And I always tell Tokuyama people that we have a mistake in the name, the 2. The number 2 in the name, it's making confusion. The real name should be just OPA, that is opaque. It's a very opaque mass to be used as first layer when you don't need translucency. Just to mask, just to stop the light. If you don't use this properly, the risk with Tokuyama materials is to have a gray restoration. So I really love the mimetic behavior of this kind of composite, because this composite forgives you. If you make a mistake, it forgives you. It just help yourself to have a beautiful result. But the other face of the moon is that it can be quite translucent. So if you are not able to properly mask, to stop the light with the OPA2 mass, you will have a gray restoration. Then you can use the dentine. These are opaque. Opaque 1, opaque 2, opaque 3. OA1, OA2, OA3. If you want to layer in anterior region, you can use this one, but just one. You don't need to desaturate. If your chroma is 2, just put OA2. You don't need to use OA3 and then OA2. Just one, because the material help you to hide everything, to give you the natural effect. Then you can use an enamel like the last one, CE, translucent enamel, to cover everything. And it's very nice because this final layer of enamel, it completely hides your restoration. So this is the key of the mimicry. Then we have other masses. We have a complete series of this colored label. We have A1, A2, A3 without the O. They are not opaque. They are medium opacity. So if you want to use them just single mass for posterior, for direct veneering, just to cover with no layering, you can use this kind of mass. You have the B1, you have the C1, you have whatever you want. Then we can use the WE. It's a very high value enamel, especially with young patients. Or maybe you can use the bleach mass if your patient has bleached teeth, or maybe in some countries, in some areas of the world, we have this kind of preferences for very bleached smiles, so you can rely on this kind of mass. Let's see how to layer in the details. So you have to make the first palatal layer. According to Vanini, to the old technique, it should be enamel, just enamel. But remember, if you just put enamel, the risk with this kind of material is to have a gray restoration. So you need to stop the light from the very beginning. And if you take a look to the image, you can see that first part of the palatal layer is opaque, OPA2. And then you just put some enamel composite, CE enamel composite, on the incisal third. Because if you need translucency, you only need it in the incisal third. You never have mamelons in the middle of the tooth. Then you light cure and you put just one layer, a big amount. You make the old dentin with just one mass. And you can use OA2, OA1, OA3, whatever, depending on the color of the tooth you need to restore. Of course, if you need, you can put some stains. You can choose, I don't know, you can mix clear supercolor with blue supercolor, or maybe you can use some opaque supercolor to make the incisal halo. And then in the end, you just need to cover everything with the CE enamel. In 90% of cases, you don't need anything else. It's so simple. And just to talk about simplicity, I always use this picture taken from Facebook. And this is a picture of a colleague, I don't know actually, it was given to me by Walter Devoto. And you can see this colleague is saying, these are the composites I use for final restoration. It's a huge amount of composites. It's more than 20 syringes. So what for? Just to complicate or just to show your ego to people? I think it's not a smart way to work here, just to complicate your life. And if you take a look to this picture, you can see on the left a very complex situation. But if you understand the rules, it's easy to move from A to B in a safe way. On the right, you see a complicated situation. It's not easy to move. You risk your life. The problem between complex and complicated is that they are the antonym of the same word, that is simple. So sometimes when I push and I say, you have to make it simple, you have to keep it simple, it's not because I'm saying you have to work without paying attention. No, I love complexity, but I don't want complications, because complications are just mistakes. So I love the word simplexity because I want to use it not only in my job, I want to use it in my life. I love complexity, but I need to avoid all the chances to make mistakes. And so I need protocols. Protocols may be boring, I know, you always do the same stuff, but it's the safest way to do something. let's take a look to some clinical cases. You can see here an old restoration that is very ugly. You can see secondary caries. You can see whatever you want, but the shape is not so bad. So I used the old restoration to make the silicone key without asking to my lab technician to make the wax-up. You can see a very thick incisal halo, and then a big mamelon on the center and the distal part, and a small mamelon on the medial part of the other tooth. So I always put rubber dam on. I'm very deeply in love with rubber dam, of course. And once I started to remove the old composite, I found out these two screw pins. Maybe the old dentist didn't believe enough in adhesion. And this is the situation after cleaning everything. And you see the first layer, but it's easy to understand that it's made with two different composites. OPA2, the opaque mass in the middle third, and translucent, the CE enamel, just in the incisal third. Why this? We already said, if I have, and I underline, if I have translucency, I have it in the incisal third. I don't want to have translucency in the middle third because the risk is to have a gray restoration. Then, of course, the interproximal walls, and I love to use posterior matrices to make the interproximal walls in the anterior teeth. And then with just one opaque, in one shot, the dentin with the small mamelon in the middle part and the big mamelon from the central to the distal part. And then everything covered with a thin layer of the CE enamel. And it's done. It's a 5 minutes layering technique, nothing more. And now you can see the first case where I used the new burr for finishing and polishing. I made this case, if I remember correctly, on Wednesday. And next Saturday, Jordi came into my office and brought me the burr. And you can see now I just made a normal polishing with the red ring flame burr and some silicone tips. And you can see a huge difference between the natural texture of the tooth and the surface of my restoration. It's more evident when you remove the rubber dam, and you can see a completely different way of reflecting light. Then, on next appointment, I saw that color was nice, translucency was nice. I just took the burr gave me by Jordi, a couple of movement horizontally, a couple of movement with a silicone tip, and take a look to the difference in the texture. So it's really helpful because this kind of texture changes completely the appearance of the tooth. It's just an illusion, but it's the different way of reflecting light that is completely different. So the key point is simplify. Simplify means reduce the number of composites you're using, reduce the number of layers, reduce the number of instruments, just use the essential. So you will reduce the chance to make mistakes and to do something wrong. But if you do something wrong, it will be easier to correct. Because if I just use 3 different layers, enamel, one dentin, the same enamel, if I see a mistake, it will be easy to understand where the mistake is and to correct it in a proper way. We can simplify even more with the other composite from Tokoyama, that is Asteria, that is completely different from the philosophy point of view, but shares the same concept for mimicry. So you see in the complete kit, you have all these syringes, so 12 syringes. It's a small kit, but if you take the essential kit, it's reduced to 7 syringes. So very small. Simplify your life, reduce the number of composites you need to use. And the concept it's strange, because when I used to be a student, my teachers, they told me that to make beautiful restoration in anterior teeth, I needed to use a lot of composites. The big kit with 30 different syringes was the dream of me as a student. And now you tell me that I can use just one body, just one color to make an anterior restoration? Yes. Because if you don't have characterization, if you don't have mamelons, if you don't have translucency to replicate, you choose your body, A1 body, A2 body, A3 body, and you make the palatal layer with that body and everything else in one shot with that body. Monoshade, completely easy to do and to correct if necessary. If you need to make some translucency in the incisal edge, of course you need to use enamel, but very small quantity of enamel. And once again, the first palatal layer, it's been with two different materials. The body, quite opaque in the middle third, and the incisal third, it's made with enamel, NE, the translucent enamel for Asteria. Then you need to create the dentin with just one layer of one body, and you complete all the layering toward the buccal surface with just that body. If you see, the difference between this one and Stellite Sigma Quick is that you don't have enamel here. You only put enamel in the incisal third, palatal and buccally. Of course, if you need it, you can use stains, you can use blue, you can use white, or whatever you want. And then you put the translucent enamel just the incisal third. This is very important because if you don't trust this rule, if you don't follow these rules, and you put enamel all over the buccal surface, you will have a gray restoration, believe me. So just reset your mind, just think to just one body, choose that one body, and only if you need it, you can put some enamel in the incisal third. So the concept is completely different, but believe me, it's very effective and very simple. Take this case, a young lady with a very dark left upper central incisor. So we make the endorretreatment. I will skip a little bit because we're running out of time. And internal bleaching. So we reach this result with the bleaching, with the walk-in bleaching. And I see no particular translucency here, just a slight halo, nothing. I don't want to complicate my life. I choose to make it with just one body, just one material. So a little bevel, adhesive procedure, A1 body from Asteria for the palatal layer, the same A1 body for the interproximal layer, and in just one shot, everything filled with just one body, A1 body. Finishing, polishing, the removal of the rubber dam, and the control picture. And you see that the material you have different behavior depending on the thickness. So you have the incisal edge, it's thinner, and you can see something, a little bit of translucency. So it's just the material helping yourself. And with just one shot in 5 minutes, you have this kind of results. This was one of the first cases that I made with Asteria. You can see it's not a Congress case. It's a very ugly case, but I want you to understand why I strictly believe in this material. So this is a young boy. He just removed the braces with the orthodontic colleague. And the colleague said, okay, go to Giulio's chair. He will remove all the composite from the braces, and he will close your diastemas. And the diastemas were in between the laterals and canine. I'm not afraid about proportion. The space, it's very narrow. But if you think to fill this kind of space, very narrow, layering different layer of composite with the old technique, so palatal enamel, dentin, buccal enamel, it's very tricky. It's tricky to have a natural outcome. The idea of making it with just one shot, just one body, and focusing only on the shape and on the finishing, for me, it's amazing. So once I removed all the composite of the braces, rubber dam isolation, of course, adhesive, and with the help of sectional matrices, just one body, A2 body, filled up, pressed. I don't care about excess. I can remove with a burr. I don't have layering, so I can do whatever I want. And with just one layer of body, I can have a nice natural looking result. This is the immediate and then the control picture. And you can see everything is done by the material. You have to do almost nothing, just to focus about anatomy and finishing. Another case, multiple diastemas, peg lateral, and different levels of the gums. And once again, I want to focus on anatomy, on shapes. I don't want to lose my time with different layer. And so just one body. Of course, we need to try with a mock-up the project. So I asked to my lab technician to make the wax-up. I duplicated, I made the mock-up, I showed it to the patient, and then we decided to proceed, focusing only on the shape and on the position of the gums. So all the adhesive steps, with this kind of instrument, it's very easy to create a new cementum enamel junction. It's like a matrix. So you can use it to pull the rubber dam and to put on the composite. And it's just one shade, just one body. You don't need to worry about thickness, about anything. You just fill the spaces with this only one body. So once all the new cementum enamel junctions were made in a very easy and quick way, I put all this one body, was a one body, and then all the shape, the final shape was given removing in the finishing steps. Then I just asked to my patient to try the new teeth and ask me for corrections. And then step by step, we started to move the transition lines, reduce a little bit the width of the central incisor. And then in the end, we reached the result that made her happy. And it's just one material. And you have no worries, you have no anxiety, and if you need to correct something, it's very easy to plan the correction. So a comparison between before and after. And closing our very, very fast chat about the use of these beautiful materials, another case. This is a colleague to be actually is a student of the dental school. He has a root canal treated 1.1, and the 2.1 was necrotic. So he came to my office asking for two veneers, and I said, okay, let's start with the root canal treatment, internal bleaching, and let's see what we can do. If we can avoid ceramic in a young boy, it's safer, it's less expensive, and it's also more fun for me because I really love layering. So this is the endo part, and then of course the flowable to stop the gutta percha, so we don't have the risk to have the bleaching agent going into the root and making some mess. And this was the result after the bleaching. You can see the 2.1 is nice, but the 1.1 was still very brown. So before going to the lab work, to this ceramic, to a complete veneer, I said, okay, let's try it directly. Let's see what we can do. Maybe we can reach a nice result with just one composite. And if you take a look, we also have a different position of the gums. So I said, okay, let's try also to push the gum a little bit apically, and let's see if we can have more symmetry. So first of all, I removed the old restoration, and then to help myself to hide the brown color, I use this very nice super color from Tokoyama that is MCO, medium chroma opaque. So it's like the opaque from the lab, the opaque that the technician uses to cover the metal in PFM crowns. In a very thin layer, you can really reduce the chroma of the basis of the restoration. Then light cure, and using once again the Gengiva instrument from Stella Italiano, I created the new cementum enamel junction just to push apically the gum. And then this is all one body, just one body. You see, I left some space here because in the incisal edge, I want to make mamelons. So I need translucency here. And the incisal edge is completed with the NE enamel from Asteria. Then we complete the frame, making the interproximal wall with just one body. All the dentinal body of the tooth has been made. You can see the 3 mamelons. You can see the incisal halo made with the body, and in between some clear color to enhance the translucency. And then just in the incisal edge, some NE enamel. And then I told my patient, okay, now I will try to reduce the thickness. You can see I have some composite in excess here. Why? Because I'm on the rubber dam. I have no perception of color now. So I rather put more composite now and try to remove it without the rubber dam and find the compromise between the perfect shape and the nice color. So I just made the first polishing and finishing without going deeply into finishing, and I told the patient, okay, come back next week. And when he came back, I started to say, okay, the color is nice, so we can reduce the thickness of the tooth. And I can do it easily because I only have one body here. I don't have the risk to lose my layering. So I start reducing until we found the compromise in between the shape and a nice color. And so me and the patient, we agreed with this situation. You can see a polarized picture, and it's nice to understand the differences between translucency and opacity. And then once again, another control, a 5-month control. And you can see the new level of the gum. It's quite symmetrical. And with just one body and a little bit of enamel only in the incisal edge, we had a nice result. Maybe, I don't know, in 10 years from now, we can make some veneers, ceramic veneers, so maybe we can just replace the composite. So the before picture and the after picture. So I think I've been quite in the time. You know, I'm Italian. We as Italian are always in late. I always try to respect the timing. And just to summarize a little bit, please focus on the opacity. The main problem with Tokuyama products is opacity. You need to understand with Estelite Sigma Quick that you need to use OPA2 mass as first layer. And with Asteria, you need to understand that it's a monoshade body composite. And the enamel, it goes only in the incisal edge if needed. Another tip I can give you is never, and I repeat, never use resin, modeling resin or bonding to wet your brush or to wet your spatula. You don't need it. The handling is very good. But if you wet the composite with resin, you will dilute composite. So you have a loss of opacity and you will have translucent gray restoration. So if you follow these small tips that I gave you, and if you just make some experience, some trials with this kind of material, believe me, you will have predictable restorations, predictable results in a very quick time, and no anxiety at all. You can just schedule everything for 1 hour appointment, and you're 90% sure that the result is good. Okay, so Dr. Smith, it's real that I was in time, or I've been too Italian tonight. I was in late. What time is it? 5 to 8. Corny, can you hear me? Hello, Dr. Smith? I have some problem in hearing back Dr. Smith. If someone Celeste, are you in? Hello. How? Can you hear me?
Hey, Dr. Pavolucci, can you hear me?
Yes.
Yes, we've got some technical difficulties with Dr. Cornay Smith. So we'll go to the answers, questions and answers quickly.
There
Okay.
we go. Am I back?
Yes, I'm
Oh, you're back.
I'm sorry. I think I lost connection there or something happened. Can you hear me now?
Yeah, you didn't fall asleep.
No, not at all.
No,
No.
not so boring. Okay.
No,
Okay.
no. I'm sorry. It seems like my connection is not stable. I apologize for that.
No, don't.
I did hear the whole lecture. I hope I wasn't frozen in some weird facial expression there. So I want to quickly just emphasize a few things. As a new user, the things that were really hard for me to get used to was getting used to the shades. So obviously we've only got shades.
I lost you again.
All of those things were quite confusing to me from the start. So I want us to quickly just go back to that. Can you still hear me?
Yeah, I lost you when you said we only have A shades.
Yeah, so I'm talking about the OPA2 and the OA2. So if we look at Sigma Quick, it can be confusing if you're used to some of the other composite brands.
It can be confusing.
So,
and if you allow me, I can put back the slide with all the syringes.
Yes, yes, and I think let's just emphasize those points, because I think as a new user, it's so easy to think that a body shade is the one that's only the A shade, the A2 or A1, and that's probably the worst thing you can do, is to use only that shade, because then everything will be gray.
Okay, you can see now the slide.
Yes.
Okay, so let's go through. You're right. This is the key. So just think about this OA1, and you also have OA2 and OA3 are the dentine. So they're quite chromatic, and you can use them to make the dentinal body of your anterior tooth. But they all need underneath a thin layer of this one, because they're not enough opaque. So this one, my suggestion is always take a pen and cancel the 2 number, because it's too easy to think to this color as A2 shade. It's not A2 shade, it's just opaque. So this is the opaque, and it should be used as first layer on the palatal side to stop the light. Very thin layer, 0.5 millimeter, not more. And then you can make all the dentinal body with one of these 3, OA1, OA2, OA3. And then you cover with CE enamel. If you have enough natural tooth structure all around, the composite will take the color from the tooth. It's quite impressive. If you have a little bit of tooth around, the light will be spreading all over the restoration and the tooth, and you will see no differences. So don't worry if you don't have the C color here, or you don't have the C3. If you need to make something that is very dark, very low value, you can increase a little bit the thickness of enamel, but it's not so common to have this kind of problem, because they are very mimetic. And you just need to understand the use of OPA2 as first layer to mask, to stop the light.
Yes. Yeah. So I want to just add to your point there. So I actually did a case today where it was a very clear C2 color. And obviously, you know, we are so used to going to then our shade guide and trying to mimic those colors, or to find a composite on our drawers that is a C2 shade. But what is the beauty of this material is that it really takes on the color of the tooth that you're working on, especially if you play with opacity. So
Yeah.
I know that we are hammering on that point, but that is really the key here.
Yeah,
so playing with the width and the thickness creates more of a grayer tooth. So if you have a thinner layer of the OPA2, or if you have a thicker layer, then you can create more of a C shade. And actually, all of that is still hidden, and it almost magically disappears if you make a mistake and you are slightly too thick or slightly too thin, because the composite just takes on the shade of the tooth. So,
As I said,
and it really is
it
that
forgives
simple.
you. It forgives your mistakes. So that's why I say that I have no anxiety in doing it.
Yes.
It happened to me with a great colleague in Italy. I don't know if you ever heard about him. It's Ignazio Loi. It's a prosthetic guy, the father of the BOPT technique. And I was in his office, and I brought him some composite, and just to present the material. And he said, "Okay, let's try it on the field. Let's go. We'll make a feeling. What should I use?" And it was with Asteria, but the concept is the same with Stellate Sigma. And I said, "Okay, Ignazio, which color do you see in the patient?" And he said, "It's clearly A2." And my answer was, "Okay, use A3." And he said, "Why? Use A3. You see that it's clearly A2? Yes, use A3. And then you will tell me." He used the A3 and he said, "It's perfect. I see nothing." So you can even make it wrong on purpose. It will just take the light from the rest of the tooth and hide itself. Yes. But you need to manage opacity. If you make a mistake on opacity, you will have too white or too gray. Most of the time it's too gray. And you would see the difference between restoration and tooth. This is the key.
If you can give an advice, three is essential. And sorry, did I
lost you again.
Am I back?
Now you're back.
Okay. So if we want 3 syringes to start with, it would be the OPA2,
OPA2,
the
OA2,
CE,
and CE.
Yes. And with those 3, you can almost do most teeth.
Yeah, a lot of them.
Okay.
A lot.
Perfect. I'm going to go through some of the questions.
Yeah.
So the one question here is, thank you for sharing. I just wanted to ask what you mean by changing the cemento enamel junction and how you do that with composites.
Okay, let's take the last case I showed you. You know, the cementum enamel junction has a thickness. It's quite thick, so you can scratch and you feel the thickness of the cementum enamel junction. And this thickness of enamel, it's what is keeping the gums in position. You can see it also here. Where is it? Okay, as I showed you, in this case, I had different levels of gum. And you can see this one, in the tooth 1.1, the gum is more incisal, because the tooth is more palatal. So you have the cementum enamel junction that is just below the other one, and the gum follows it. If you, with this instrument, you pull the rubber dam, at the same level of the other one, and you put composite here, you will have a new cementum enamel junction like this one. So you have a new profile of the enameled surface, and this new profile will push the gum level, and then the gum will just adapt itself to the new position. This is very common to do with prosthetic. It's a job that we can make with the temporary restoration, modifying the border of the temporary restoration just to push up and down the gums. But you can also do it with composite.
Yes.
Like here. And
Perfect.
it's something that I really love to do.
Perfect. I'm going to go to the next question that we have, and it's okay. To confirm, if you use the universal shades from Estelite Sigma Quick Composite, it will result in a gray restoration. I think we.
Yeah, if you use it in a class 4, so you have from buccal to palatal, yes, the risk is to have it a little bit gray. If you just want to make a veneer of a pre-existing surface, so you don't need to modify the width of the tooth, and you just have to put some composite over the tooth, you can use the universal shade. It works perfectly because you have the natural tooth to stop the light.
Perfect. And then, oh, someone's asking, yeah.
I lost you again, sorry. Now, try now. Yeah.
I'm so sorry about that.
No, don't be. And now
so,
I can see you.
Someone else asked about the book that you spoke about in the beginning. Perfect.
It's an old book, Fundamentals of Aesthetic, from Claude Ruffenacht. You maybe can find the new edition that is from, I think, half of the 90s, and the cover is yellow. It's nice, this one, but you have a lot of clinical cases there. And of course, there are clinical cases from 90s, so they're not so useful now. The first one, the one with the white label, the white cover, it's just theoretical. You have a lot of drawings, and it was enlightening for me. It was beautiful. I read it as a student, and I always remember it.
Great. I think it seems like that's it for now. I see that there's some other questions about the burr that you spoke about. I think that made an impression on everyone. And it seems like the guys from Milner's, Celeste and Sharon and everyone is answering the questions on the burrs. I'm not sure if it is available from Milner's. I'm going to hand over to Tanya now. Tanya, do you want to maybe just end off with giving some product information?
Can you hear me?
Yes.
Okay, perfect. So just on the burr, Doc, can you just show us the burr again? We have a similar one in the Horico range, but we don't have that specific one. But
you just need, it's not the product.
Yes.
It's just the concept. So having a low speed burr, so for the blue
slow hand piece,
yeah, for the slow hand piece, you need something that is quite a flame shape, so it's straight, and blue grid, so strong diamond. Everything is fine. Before having this kind of burr, I used to take a prosthetic burr, the flame, the blue ring burr, and using it to scratch with my hand, not on the handpiece. So it's not the object, it's the philosophy behind. And having this kind of burr in a slow speed handpiece, it's beautiful. So you can use whatever you want, but it's slow speed, very gentle touch with a high grit diamond.
100%. Okay, so we'll look for that burr in the Horico range. I see a few pictures coming through already from the sales team. So you can chat to your Wright Milner's representative and they will have the info.
Perfect.
We do have some specials for tonight. So you can also contact your Milner's representatives. I don't know if you want pricing. The Asteria composite's not available yet in South Africa, but we've got pricing. We are taking pre-orders, so if you want to order and want to try, you can order with your Wright Milner's representative. And then I would just like to take the opportunity to thank Dr. Cornet and Dr. Pavolucci for your time. I know it's late at night for us and we're all a bit tired, but thank you for your time and your knowledge and sharing that with us. Not a lot of people share so much. So thank you very, very much from our side.
Thank you. It was a pleasure.
My pleasure. Thank you. Any other questions from
Thanks.
a product point of view? Oh, Dr. Mark Bose says he uses a similar bird from Orico. Dr. Mark Bose, do you have a code for us maybe?
And then, Tom,
Yes.
can you hear me? So Ashana just asked, can you please repeat the 3 shades that was recommended?
Yes.
So she's asking the 3
Yes,
recommended
the first
shades.
one is,
Giulio,
the
do you
first one is OPA2. OPA2, the opaque mass. This is the key. Then I recommend the CE enamel, the clear enamel. In the middle of between these two, you can choose one of the dentines. So OA1, OA2, OA3. Of course, if you have most of young patients with very bright teeth, you can choose the OA1, or maybe you can use the OA2. But believe me, the difference is not so high because the mimicry is amazing. So you will see, if you make a couple of central incisor, OA1 in one and OA2 in the other, you will see no differences.
Perfect.
Perfect. Thank you.
Oh.
Okay, so are we happy to end tonight, Tanya? I don't know if you guys have anything else to add.
All good. We'll send out the promotional pricing to the attendees because there's nice promotions, and then yeah, that's it.
Perfect. Thank you so much, Giulio. It was really nice to learn from you tonight.
My pleasure to
Thanks
know
for
you.
your time.
Hope to meet you in person soon.
I'm definitely going to come visit you in Italy, without a doubt.
I meant it when I said contact me, because from a touristic point of view, I'm very nice. I can show you a lot of nice places in Tuscany.
Perfect.
And let me just thank you also, Johnny from Japan, that is late night awake, and thank for your job, thank for your support always.
Thanks, Johnny. Okay,
Thank
guys.
you. Okay, bye.
Oh, bye. Good night. Thanks again.
Good night.
Bye.